You're in the middle of your day, everything seems fine, then suddenly something feels off. Your arm goes numb, your vision blurs, or maybe your speech starts slurring. You try to shake it off, thinking it's just stress, dehydration, or fatigue. But what if it's something far more serious? Stroke is not just a concern for the elderly. It's the third leading cause of death among American women of all ages, claiming more lives than breast cancer and Alzheimer's combined. Every year in the U.S., 55,000 more women than men suffer a stroke, and nearly 100,000 women lose their lives to it. According to the CDC, 1 in 5 women will suffer a stroke in their lifetime, and many won't recognize the warning signs in time. The worst part? Many of these deaths could have been prevented only if the warning signs were recognized in time. Women often experience stroke symptoms differently than men, which is why many strokes in women go undiagnosed or are mistaken for stress, exhaustion, or even anxiety attacks. Some women experience no pain at all, just a subtle, strange sensation that something isn't right. By the time they seek help, the damage is already done. If you're a man watching this, keep going, because the life you save could be your wife's, your girlfriend's, your mother's, your sister's, or even your daughter's. Many women don't recognize their own symptoms, which means it's often a loved one who calls for help. Every minute a stroke goes untreated, 1.9 million brain cells die. That's why recognizing the early warning signs could mean the difference between full recovery and permanent disability, or even death. Some of these signs are well known, but others will shock you. Are you ready? Number 1, sudden numbness or weakness on one side. This is the most common and widely recognized stroke symptom. Imagine reaching for your phone and suddenly your arm feels heavy, like dead weight. Or maybe you're walking and your leg unexpectedly gives out. One-sided numbness or weakness happens because a stroke cuts off blood supply to the brain's motor cortex, affecting voluntary movement. A 2022 study in the Journal of Stroke and Cerebrovascular Diseases confirmed that women often downplay this symptom, assuming they just slept in a bad position or need to shake it off. But this is a major red flag, especially if the weakness appears suddenly and doesn't go away after a few minutes. Even if it's mild, it could be the start of a larger stroke. If one side of your body feels numb, weak, or tingly, call emergency services immediately. Waiting too long could lead to permanent paralysis. Number 2, slurred speech or trouble speaking. You're mid-conversation, but suddenly your words sound jumbled. Or maybe you try to speak, but the right words won't come out. This happens when a stroke disrupts blood flow to the brain's language centers, making it difficult to articulate thoughts clearly. A 2020 study found that slurred or incoherent speech is one of the earliest signs of stroke in women. Some women can still think clearly but struggle to form words, while others experience difficulty understanding what's being said to them. The best test? Ask the person to say a simple phrase like, "The sun is bright today." If their speech is slurred, garbled, or they can't repeat it at all, assume it's a stroke until proven otherwise, and seek immediate medical attention. Number 3, a pounding headache unlike any before. Not all strokes cause headaches, but when they do, it's usually an unmistakable thunderclap-like pain. Women are more likely than men to experience a sudden, severe headache before or during a stroke, especially when it involves bleeding in the brain. A 2017 study published in Neurology found that hemorrhagic strokes, caused by ruptured blood vessels, often begin with an explosive headache, sometimes described as the worst headache of my life. Unlike migraines, these headaches strike suddenly, often with nausea, vomiting, or even confusion. Women taking birth control pills or those with high blood pressure are at an even greater risk. If you experience a headache that feels different from anything you've had before, don't assume it's just stress. Get medical help immediately. Number 4, sudden vision changes in one or both eyes. Your vision suddenly goes blurry, or you lose sight in one eye completely. Maybe it feels like someone dimmed the lights, or you see double. Stroke-related vision problems happen when a clot disrupts the occipital lobe, the brain's visual processing center. A 2019 study in Stroke Journal found that women are more likely than men to experience isolated vision symptoms before a full-blown stroke. Some describe it as tunnel vision, while others report sudden flashes of light or blind spots. If your vision suddenly changes without explanation, don't assume it's eye strain. Get checked immediately. Number 5, loss of balance or unexplained dizziness. You're walking normally one moment, then suddenly feel like you're tilting to one side. Or maybe the room spins around you, making it impossible to stand. Many women dismiss sudden balance issues as dehydration, low blood sugar, or vertigo, but these can be warning signs of a stroke. A 2018 study found that women suffering from a stroke in the cerebellum, the part of the brain that controls coordination, often experience dizziness, trouble walking, and sudden unsteadiness. These strokes are often misdiagnosed because they don't always present with the classic symptoms like facial drooping. If you feel suddenly off balance, can't walk straight, or have unexplained vertigo, assume it's a stroke until proven otherwise. Women not only suffer more strokes than men, but also face higher risks of disability and death. They account for nearly 60% of all stroke deaths, with unique biological and lifestyle factors increasing their vulnerability. 1. Birth control and hormone therapy. Oral contraceptives and postmenopausal hormone therapy, HRT, increase stroke risk by up to 29%, especially in women over 35 who smoke, 2022 neurology study. 2. Pregnancy and preeclampsia. High blood pressure during pregnancy raises stroke risk by 400%, with long-term effects even years after childbirth, 2021 circulation study. 3. Autoimmune diseases. According to the 2020 Stroke Journal, women are twice as likely as men to have lupus or rheumatoid arthritis, both of which inflame blood vessels and double stroke risk. 4. Migraines with aura. Women experience 3 times more migraines than men, and those with aura are also 3 times more likely to suffer a stroke, 2018 BMJ study. 5. Atrial fibrillation, AFib. Women with AFib have twice the stroke risk of men with the same condition, often due to delayed diagnosis, 2020 Stroke Journal. 6. Stress and depression. According to the 2022 JAMA study, women have higher rates of chronic stress and depression, raising their stroke risk by 44% due to increased cortisol and blood pressure. Regular blood pressure checks, stress management, and early detection of hormonal and cardiovascular risks can significantly reduce stroke risk. Yet even with prevention, strokes can still happen, often in ways that many women don't expect. Some symptoms are so subtle that they're mistaken for everyday fatigue, dizziness, or even indigestion. That's why recognizing the warning signs is crucial. Now, let's look at the remainder of the dangerous signs of stroke that every woman needs to know. Number 6. Sudden confusion or trouble understanding. You're reading a text message, but the words suddenly don't make sense. Or maybe someone is talking to you, and although you hear the words, they don't register in your brain. This type of confusion can be an early stroke symptom, especially in women. A 2020 study in the Journal of Neurology found that cognitive impairment is often one of the first signs of a stroke, particularly when it affects the left hemisphere of the brain, which controls language and comprehension. Unlike normal forgetfulness, this confusion appears suddenly. A woman experiencing this might forget common facts, struggle to follow directions, or even fail to recognize familiar faces for a moment. Some women mistakenly assume they're just tired, overwhelmed, or experiencing brain fog from stress. But when confusion comes on out of nowhere and affects decision-making, it's time to seek medical help immediately. Number 7. Hiccups with chest pain or difficulty swallowing. Hiccups might seem harmless, but when they appear out of nowhere, especially with chest discomfort, nausea, or trouble swallowing, they could indicate a stroke, particularly in women. A 2014 study from Wake Forest Baptist Medical Center found that women are significantly more likely than men to experience non-traditional stroke symptoms, including persistent hiccups. This occurs when a stroke affects the brainstem, which controls involuntary functions like breathing and swallowing. Some women report a sensation of tightness in the throat, as if something is stuck, or mild discomfort in the chest that they mistake for heartburn. The key here is sudden onset. If hiccups start abruptly and last longer than usual, especially with chest pain or dizziness, seek immediate medical care. Number 8, nausea and vomiting without a clear cause. You wake up feeling queasy, lightheaded, or even on the verge of vomiting, but you don't have food poisoning, a stomach virus, or any known reason for it. While nausea is a vague symptom, when it appears suddenly with no other explanation, it could be a sign of a stroke. A 2018 study in Stroke Journal found that women are more likely than men to experience unexplained nausea and vomiting as an early warning sign, especially when the stroke affects the cerebellum, the part of the brain that controls coordination and balance. This means nausea often appears alongside dizziness or difficulty walking. Many women dismiss this symptom, assuming they ate something bad or are just dehydrated. But if nausea appears out of nowhere and is accompanied by other unusual symptoms like confusion or weakness, don't wait. It could be your brain's way of signaling distress. Number 9, facial drooping. You look in the mirror and notice one side of your face isn't moving quite like the other. Or maybe someone tells you your smile looks lopsided. This happens when a stroke affects the facial nerve, weakening one side of the face. According to a 2021 study published in The Lancet Neurology, facial drooping is one of the most recognizable stroke symptoms, yet many women delay seeking help because they assume it will go away. Some women even try to massage the affected area, believing they just slept on their face wrong. A simple test. If you suspect a stroke, try smiling. If one side of your mouth stays down, or if your face feels numb or heavy on one side, call emergency services immediately. Number 10, extreme fatigue or sudden exhaustion. You're going about your day, feeling fine, and then, out of nowhere, you feel an overwhelming wave of exhaustion. Not just tired, but completely drained, as if your body is shutting down. While fatigue is common in daily life, sudden, unexplained exhaustion, especially when it's severe, can be a warning sign of a stroke. A 2017 study in Stroke Journal found that extreme fatigue is more common in women experiencing a stroke than in men. This happens because the brain is suddenly deprived of oxygen-rich blood, which trigger a full-body energy crash. Some women also report feeling mentally foggy, struggling to concentrate, or having difficulty staying awake. Many women assume they just need to rest or take a nap. But if this kind of fatigue appears out of nowhere and feels abnormally intense, it could be your body's way of signaling a medical emergency. Don't ignore it. A stroke is a medical emergency and every second counts. If you or someone around you experiences even one of these symptoms, here's what you need to do. Call 911 immediately. Don't wait to see if symptoms improve. They won't. A stroke is a race against time. An emergency treatment within the first 3 to 4.5 hours can significantly reduce brain damage. Note the time the symptoms began. Doctors need to know this to determine if clot-busting treatment, TPA, is an option. Some strokes can also be treated with a thrombectomy if caught within the first 24 hours. Do not drive yourself to the hospital. Strokes can worsen within minutes, leading to unconsciousness. Just wait for an ambulance, as paramedics can start life-saving treatment on the way. The faster a stroke is treated, the greater the chance of full recovery. In fact, studies show that patients who receive medical attention within the first 3 hours of symptom onset are 75% more likely to recover without severe disability. Not all strokes are the same. Some warning signs appear early and give a person a chance to get help, while others occur only in the final moments before a major stroke strikes. The sooner you recognize a stroke, the better your chances of survival. According to the American Stroke Association, Nearly 93% of people who suffer a late-stage, untreated stroke will either die or experience permanent disability within 5 years. That's why knowing these early warning signs is so crucial. They could mean the difference between life and death.
And there you have it. What are your thoughts? Next, dive into this video for more essential tips to transform your health and help you thrive. You're going to love it. Thanks for watching Healthy End, and we'll see you there.